Hello, my name is Dr. James Perry, and I'm Clinical Lead of Transformation at eConsult. I'm here today to talk to you about how using a total triage model alongside our structured data gathering template can help you fulfill the requirements of the new PCN DES and IIF contract. What we know already is that by using a structured data gathering template, you're much more likely to remotely close a case. You're also much more likely to care navigate a patient to the right place. On top of this, you're far more likely to book a patient into the right slot with the right person at the first time of asking. When compared to our free text competitors, we know that you don't have to go back to ask for more information to then re-triage a patient with a decreased likelihood of remote closure. Therefore, you're way more likely to reach the PCN DES and IIF contract targets. I'm going to talk to you now a little bit about those contracts, and then we'll come back to a triage model. On screen here, you can see the PCN DES contract. I focused in on ease of access and demand management, as they clearly state that you must have an online consultation messaging and appointment booking functionality in place. eConsult offers this to you. They've also stated that they want online consultation usage per 1,000 patients registered. They haven't stated the number that they'd like, whereas last year they did. However, they have alluded that they will be observing that ratio, and therefore it's important that you pick an online consulting module that you like, enjoy, and your patients equally like. This is way more likely to be the case if they're getting care quicker and they're getting signposted to the right point of care sooner. Point 3 shows that they want to increase accuracy of recording appointments in the appointment book. They've specifically listed certain slot types that they'd like to look at, and that's more involved in the IIF element of the contract. But we know that by using eConsult, we can represent our work more clearly in the appointment book. I'm going to move into the IIF contract now, where they've clearly stated that they think that patients should be seen in certain slot types within 2 weeks. They've given us 6 weeks to work on a strategy to meet this, and eConsult are more than happy to help you develop this strategy, as obviously online consulting plays a huge part in it. They've then said that they're going to look at how we work with commissioners to develop that strategy, and then they'll look at how we roll it out. And the first place that they've shown a target is of a lower threshold of 85%. So that's showing that 85% of patients need to be seen within 2 weeks, with an upper threshold of 90%, worth 71 points. They've clearly showed that their intention is to improve access to general practice. What they have said, and I'll highlight here, is that they believe that clinical triage counts towards that 2-week target. Therefore, if a patient presents to the practice and they're triaged within 2 weeks and either remotely closed or signposted to another service, that counts as appointment activity. And they've clearly said that that interaction would be within the scope of the contract and would be deemed a success. Equally, if you triage a case and you feel that a patient can wait for a week or 2 to be seen through using our structured templates, that also goes down as a win. And that again could be 2 appointments. It could be 1 appointment for the triage and 1 for the appointment that you've offered. Again, if you triage a case, mean clinical triage being 1 slot type, and offer an appointment within 4 weeks because you feel the patient can wait for that long, that would still leave you neutral in terms of appointments, as you have triaged them within the boundary of the contract. So therefore, it's very important that you get a system in place whereby you can triage efficiently and quickly, and you are able to remotely close more easily. I'm going to come back to the triage model now. We know that clinical triage is felt to be really important based on the contracts that have been set out, and therefore we have a care navigation system with a clinician at the heart of it. Depending on the size of your practice, this may change. So if you're 5,000 list size, you may feel that you want to have a clinician in the room for X amount of time with some clinical documentation and an up titration list to the GP for the rest of the time. If you're around 10,000 patients, you probably need a clinician in there per session. Bigger practices might need more. However, that means that your care navigators have constantly got someone they can go to and from. It meets the requirements of the contract, and the appointments that are offered the other side are going to be safer, and you're going to have more efficiency in your system. We remotely close or care navigate away about 40% of patients, and therefore that frees up huge capacity in your system to get someone booked in within 2 weeks. I hope this has helped you see a little bit how using a structured data gathering template can drive efficiency, retain safety, and therefore enable you to meet the requirements of the contract. If you'd like to talk a little more about how we can help you with transformation in putting that clinical triage team in place, I'm more than happy to do that with you, as will the rest of the clinical team or the transformation team at eConsult.